Pneumonia, diarrhea, HIV, and tuberculosis are preventable and treatable, but they are still killing children in large numbers. Major causes of death among children vary by age. Children under 5 are especially vulnerable to infectious diseases like malaria, pneumonia, diarrhea, HIV, and tuberculosis. For older children, non-communicable diseases, injuries, and conflict pose significant threats. Despite being entirely preventable and treatable, common infectious diseases are still killing young children in large numbers. Pneumonia, diarrhea, and malaria were responsible for approximately 30% of global deaths among children under the age of 5 in 2019. Children in the world's poorest regions are disproportionately affected with infectious diseases, particularly prevalent in sub-Saharan Africa. What is the role of immunization in preventing these childhood diseases? Today on your regular Health TV talk show, The Physicians, we'll be discussing the common childhood diseases, the role of immunization. Stay tuned. It's another day with The Physicians, where your health is our business. Today we'll be discussing common childhood diseases, the role of immunization. My name is Dr. Martina Agbere, one of your anchors on this program. And with me, as usual, is my co-host.
I'm Dr. Memuna Yusuf Kadri. It's always a pleasure to have you on set. Of course, on your regular favorite Health TV talk show, The Physicians, your health is our business.
So we're discussing common childhood diseases, the role of immunization. So why are we talking about the role of immunization? It just simply means it's very important, right? So I don't know if in your community you have had resistance, parents not wanting the children to be immunized, some clerics saying children should not be immunized. Have you had such a thing before in your own community?
In 2022, I don't think that is an issue for childhood diseases.
Okay.
But for COVID, yes, for vaccination. But for childhood diseases, I think we have come way back. Parents seeing the benefits, because stakeholders meetings were held. The religious community played very significant role. Then, of course, town hall meetings.
Yes.
Resistance I noticed some years back was the booster doses for polio.
Yeah.
When they had to go to school and then they were giving booster doses for, older children.
Mm-hmm.
And they were like, but they took
When they were young.
oral polio vaccine. Now, why are they not having this? So that also necessitated another round of awareness from the town hall meetings to community leaders to
primary
health care providers.
Yeah.
No, they were there. Those ones already know what it is. But, the main people going to the market women, getting village heads to come together. Then the community health care providers.
Yes.
Then, of course, the religious communities. And I think when that was explored, it was easier to, in fact, the children will come back home with a marker and then when they now come with their box house to house, it was easy to inform them to say, no, my child in school had it, so...
Well, the benefits can be overemphasized, the numerous.
Yeah.
And you talked about polio. I recall that at least Nigeria was...
We've eradicated polio, yeah. So
anyway, we have our chief who is going to come and deep dive into this particular topic. And I'll talk about common childhood diseases, the role of vaccine. It's actually an encyclopedia when it comes to things that have to do with children. Immunization. We'll be back after this short break. Stay tuned. Welcome back. If you have just joined us, you're on to your regular program, The Physicians, where your health is our business. Today we'll be discussing common childhood diseases, the role of immunization. With me in the studio is our regular guest. She is a consultant, public health physician, and also a senior lecturer at the College of Medicine, University of Lagos. No other person than our very lovely, beautiful, delectable Dr. Alero Roberts. Welcome to our program. First of all, maybe you tell us what are the things that people, the guests, should expect? What are the common childhood diseases? Just give us an overview, general overview.
There's no back door to reading this medicine. If you want to know, anyway, let me start very quickly with this, because what every person needs to be familiar with is what I would call our routine immunization program, which immunizes against no less than 12 vaccine-preventable childhood illnesses, and starting from birth. Tuberculosis, for which the child gets BCG. Poliomyelitis, for which the child will get the first dose of oral polio vaccine. Then we move into the big five: diphtheria, pertussis, whooping cough, tetanus, Haemophilus influenza, pneumococcal pneumonia. Hepatitis, we also immunize against that. Then we come up with measles and yellow fever. Throughout all this, of course, we are giving the vitamin A fortification, which prevents against blindness, preventable blindness. So I think I've covered it. Yes, pretty much. So and then now we've introduced rotavirus, which is protective against diarrheal disease. And we're hoping to very quickly soon get in chickenpox.
Wow. So you want to just tell us about the ones that are most common in our environment?
Everything is most common. All those diseases I mentioned, they are common in our environment. Okay. That's the sad part about it. They are common and they kill. Okay. And the fact that we don't always make the diagnosis does not mean that they don't occur. In fact, right now, I might as well say it at this point in time, we are having an outbreak of diphtheria in Lagos. Wow. So, you know, there is a problem. There is something that is going on, and this is such a timely subject at this time.
Yeah, I don't want to take it away from, I like the fact that you made mention of an outbreak of diphtheria. So I want you to add it to this other question, so like it's a two-plunge kind of question. It's good for our viewers to also understand, you know, at what stages do children need to take this vaccine?
Very good. So we start at birth. So at birth, the routine immunization program gives 2 vaccines. I think 3 now, if I recall. The one against tuberculosis is imperative that the child gets that one at birth. Before we start the naming ceremony, everybody comes to greet mother and the child. That's the BCG. So we give it at or near birth. In fact, I take at birth, within 24, 48 hours, we've gone around and given it. At the same time, the child gets the oral polio vaccine in the mouth. And if I recall, hepatitis B, first dose, is also given at birth. Then comes the 6 weeks. At 6 weeks, the child gets the first dose of what we call the Penta. Now we're calling it the Penta +1, because we're giving the big 5 and Rota at the same time. And that comes up at 6 weeks, at 10 weeks, and at 14 weeks. Okay? Then at 6 months, we fortify the vitamin A. And at 9 months, we're giving the measles and yellow fever. That is our routine immunization program. Of course, for mothers who are clever, savvy, educated, and articulate, and very, very on point, they know that they can get other vaccinations for their children, and often do go out and get them, the chickenpox, mumps, and rubella, which unfortunately is not yet, notice I say yet, on the immunization program, but it is available.
As a routine, but it's available.
It is available.
Okay. So I stumbled onto a write-up this morning, and it says, according to the World Health Organization, that pneumonia is the leading cause of infectious death.
Of death.
Okay. Among children under 5. Okay. So in our own country, Nigeria,
the 2 biggest causes are the Haemophilus influenza and the pneumococcal pneumonia, both of which are now on the routine immunization program. But I believe you me, we fought long and hard to ensure that they were included in the routine immunization, because as you quite rightly said, if you recall from medical school, remember what we used to call ARI, acute respiratory illness. You recall it. And every time babies were born or babies were rushed in, we didn't even bother, you know, we knew that, acute respiratory illness, and we start treating immediately. The two biggest causes we are now immunizing against, that's the pneumococcal pneumonia and Haemophilus influenza.
It's actually very frightening because it said about 700,000 children. Okay,
yes. Those are the ones we
in a year, and that it just means like every minute.
That's
a
right.
child dies.
That is right. That is us, and those are the ones we see. Don't forget, a lot of these children, very sadly, pass away before getting to the health facility, because the problem with acute respiratory illness and pneumonia, it can kill babies and very young children within hours. Within hours, which is why immunization is so important.
Okay, so for children, for pneumonia, what is the main cause? How do they get it?
Airborne, as with every respiratory illness, airborne. So even if they come into contact, so if, okay, like, so let me expose you a little bit. Shortly before the program started, you were coughing.
Yeah.
It could have been just that you were clearing your throat. It could have been that a bit of pepper went down the wrong way. It could have been that you have a viral illness, but you're an adult. It won't be more than that cough that is just inconvenient. That's all. But if a vulnerable child was in here and the child was exposed to the droplets from your cough, which the child would be by merely coming into this place, that child, if the child was not immunized, would now be at risk of severe illness. And like I said, because pneumococcal pneumonia, the pneumococcus is everywhere. It's not that it was imported from anywhere. It is everywhere, airborne, ubiquitous, is everywhere. It's in the nose and mouth. So it's in the nose and mouth of everybody, but we have an immune system that is strong enough to cope. But the children who are not immunized don't.
Yeah. So I have this question, and I think it's good for our viewers to also hear from the experts. Those of us in the 60s, 50s, 70s that had, I think even 80s, had BCG, and some of us have MAC.
That's right.
Why some of us don't have MAC? So now this is where the myth comes in. Those that don't have MAC are thinking that they didn't have it. That is why. So that means that maybe it was, they were not immunized. And so maybe they need to retake it again. So I need you to help us bust this myth. No, Dr. Alero, wait. The second part is for those of us that, for maybe because of our class or our status and for the future of our children, we have our children outside the country for a blue passport or a red passport. When they come back, how soon should they have their children get the BCG?
So, two things right there. So the first one, the MAC.
The MAC, yes.
That's
shotgun.
No, it wasn't a shotgun. You had the
like a star.
Yeah, and the one you use in giving that.
No, the gun was small for us. But that's another day's discussion. And then you had to come back at the 6th week when your mother brought you for the 6th-week immunization. The nurses will check if nodule has formed. Then within about 3 to 6 months, a little scar, and that scar remains for life. Now, if you don't have that scar, there's a danger that there's two things. A, you are not immunized. But B, and more sadly, you were vaccinated but not immunized.
What's the difference now?
Very good question, because that happens a lot in this part of the world that is so hot. You were given the vaccine, but the vaccine was probably rendered impotent because maybe it had stayed out of the fridge for too long.
Wow.
Before you got
People are already checking. They're already checking if they
you know, every now and again, and then my children, you know. So that happened because, you know, a lot of times, and that's why we are very adamant at the 6-week immunization visit to make sure that the child has a nodule, because we are well aware that babies can be vaccinated but not immunized. Because if the vaccine remains out of, because in those, and particularly it was a lot earlier. At our time, we used to get what we call multi-dose vials. So the vial that will hold like 80 doses. So, you know, you will start to immunize, but maybe by the time it's getting to the 62nd child, the 65th child, the vaccine has remained out of the fridge
for too long.
And
with our weather.
With our weather so hot and everything, no air conditioning and so on and so forth. Of course, nowadays with technology, a lot of things have been put in place to mitigate against that circumstance. Number one, we are getting smaller dose vials. Number two, we've got ice packs, we've got solar-powered refrigerators, so in between, you know, the vaccine can be kept on ice and so on and so forth. But it's something we have to look at. So if you don't have the scar, 110% chances that you are not immune. So to the second part of the question, for those of us whose children and grandchildren apparently, so I'm speaking, this is a personal thing, immediately the child comes back to this country, get the BCG. So guilty as charged, my grandchildren were born in a place where they got purple passports. Purple with pink polka dots. Don't ask me which country. I know that. Purple with polka dots. But immediately on arrival, of course, in such a country.
Not with you have to have been
From the airport.
Straight on.
I had already called my local immunization officer of my LGA. We need you. Where? What? Do I have to buy the whole dose? I don't mind. Gather everybody. And you must immunize immediately. That's the point I'm trying to make. So immediately upon arrival, please do not let 24 hours pass.
So is it that anyone who doesn't have that card is likely to fall in that category of not being immunized? You want to throw more light?
I will stand on all my medical degrees.
And maybe the person is in his 60s.
Yeah.
Does this need to go for
I would advise it, and I know you are going to do this program I have secret information, so I'm going to leave that for another expert to come and talk about. But from the public health point of view, anybody who doesn't have the scar or is simply not sure, please, let's get it checked out. So there are things we can do. We can do the HIV test to find out what kind of immunity you have against, because the disease we're talking about here is tuberculosis. Yes. And why it is particularly important, as your next guest will tell us, I think that's next week or so. My guest coming on, so I don't want to preempt her show, but she will tell us more about it. Why it's particularly important is that we are seeing this upsurge. Wow. So it is something that should concern
there's been a simple jingle on tuberculosis on TV.
Yes, it's all over the television, it's all over the radio, the adverts are out. And
now the physician is actually putting
now
the voice
you have
on
to,
it,
yes, and thankfully you are also on top of it. So it's something that concerns all of us. And you ask the pertinent question, whether you're in your 50s, 60s, 70s, or 80s, are you still at risk? The answer is yes.
Wow.
You are still at risk. There are some diseases you can say yes, because of age. You probably will not get it again. Something like poliomyelitis, if you've survived past your 10th birthday, you are not likely to get the acute flaccid paralysis type of polio again. But the danger is that you can still transmit it to others. But something like tuberculosis, you can still be vulnerable. You are still vulnerable. And diphtheria, what I just spoke about, adults are getting it. Really? Adults are getting it, and the cases we saw are what I call adult children. 7, 11, 14.
Adult children.
Yes, big children who you would have assumed were fully immunized, and therefore this is not a problem. And in fact, that's the problem, because you just assume that, these children from this mother, I know these people, they are my people, they are fully immunized. So, your mind doesn't think about the vaccine preventable diseases. Because automatically you are like, immunized, the child is protected against that. But we are now finding out that booster doses are not being given because they are not part of the routine immunization schedule. And parents don't therefore think it is important. It is very important. So common childhood diseases, the role of immunization is critical. The last thing you need is, after you've paid January school fees, for your child to do JS3 exam, they say diphtheria took your child out. Say God forbid.
God forbid, So Dr. Alero, I want you to, because this is also very key for our viewers, and we are all hearing the news. When is it going to be part of also the routine malaria vaccine?
We are fighting hard to get it. Now, the key to that, we know it works, is building advocacy. We need to. So I'm so glad this program is coming on. I'm so glad because you mentioned this and I was listening to you very keenly. If you don't have buy-in from the community, you can introduce every vaccine in the world and governments can pay good money to bring in these vaccines, bring in the refrigeration to keep them, bring in people to build capacity, get trained staff and everything. If you don't have buy-in from the community, people will not take them,
Yeah.
and then they'll be wasted. We saw a lot of that with COVID.
COVID, yeah.
Yeah, we're already seeing signs of it with the new rota that we're bringing in.
Okay.
It's free, it's there, but we have not built buy-in, because for a lot of people that are children and diarrhea, children are supposed to have diarrhea.
Yeah.
Seriously.
You know, but they
Normalizing
don't
it.
realize that
That
there's some
diarrhea
diarrhea that
that
just
are not
kill
within
within
hours.
hours.
Yeah.
And is that kill within hours before they've told the mother in the bucket, hey, come home, oh, your child
is gone.
has passed 2, 3, 4, 5 times. By the time the mother
Shut down.
gets home through the traffic and the transport and everything, it's
because
too
of their
late.
small body mass.
They
and
have
because
small
they are
body mass,
They are giving out,
exactly.
they are not taking in.
Thank you.
Yeah.
So it is so important that we speak this message.
Okay,
So malaria will be...
Yes,
Yeah.
malaria, yes. I think from what you just said, it's very important that we have the community buy-in.
Absolutely.
Because according to the World Health Organization, it says that it is the third most deadly disease for young
Yes.
children from the age of 1 month and 5 years. And it also accounts for like 67% of global malaria deaths.
Absolutely. In
So,
children.
in
very
in
young
young
children.
children.
Babies and very young
So
children.
bringing it home, what have we done as a nation?
This is part of it. The public health
Awareness.
professionals, physicians, public health nursing, everybody should be talking to people around them. Because at the end of the day, you see, people will listen to who they trust.
True.
Exactly.
So, yes, it's good for me and all. You bring in all the experts and we sit on television and we talk, and we are just what? Talking heads.
Okay.
But the person who knows me as mommy, grandma, Auntie Lewo, Dr. R, Dr. A, if I tell that person, this is good, go and get it, that person is more like,
Absolutely.
I'm so glad that almost 90% of people I said, go get your COVID vaccine, get your boosters. Every time I mention, I'm going to get my booster, or are you coming?
They
You
follow.
know, they follow.
You are an
Okay.
influencer, you don't know
Yeah.
that.
I do know
Serious
that,
one.
but you see, I'm only an influencer for those who trust me.
Yeah.
That's the thing. So,
So
it is
we have
those
to
who
build-
trust you. You have to keep, you can start with your, because if you tell somebody and the person tells somebody else, the person will say, it's Auntie Memuna who told me. Oh." So you
Yeah.
know that I
Okay.
don't take
Check.
advice from just anywhere. I don't listen.
Yeah.
Because that's another thing. With the danger of social media, you don't want people just taking any kind. That's how
Fake
you remember Ebola and that drinking of salt.
No, battle
Don't
is salt.
let's
No,
go
no, we will never get there again.
Amen. 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 So again, it's the trusted voices
Yeah.
speaking one-on-one to everybody around it, your networks, you know, you build, and then it also gives you an opportunity to hear their concerns, because people
Yeah.
have genuine
Concerns.
concerns. And you can hear their concerns and address those concerns at the level that they can understand, because that is also critical. Because if somebody says, I don't understand, when I gave my child immunization, that second vaccine, that the child went to go and say, hey, come and see what I saw. That night in my neighborhood, nobody slept.
I didn't
These are
sleep.
negative.
The baby
But it happened.
cried for 24 hours.
But
He
it
didn't even
happened.
eat. No, I'm not doing it
But
again.
it happened.
Yeah, it happens, yeah.
And that's why we find that there's a drop in vaccination, in immunization between the second dose and the third dose.
But more of enlightenment will actually have a
Yes, and
prevented
it's also
them at the
addressing
point
their
of-
concerns, because the mother will ask me. She says, doctor, this one that I said the child is going to misbehave today. I will tell
I
you
like the
the
word
truth.
you misbehave.
The child is going to misbehave
So
today.
acknowledge that.
Be ready.
Be ready.
Gather yourself,
Gather
guard
yourself.
yourself. Have you
Yeah.
got your paracetamol
Yeah.
syrup? Warn everybody. Put net, go and buy airtime. Put video on your phone. Let the child. Once you warn the mother
They
mother
know
is
what to-
ready. They
they are
gird up.
expect- they're
Yes, they
expecting.
know what to expect. I say, but
Wow.
don't worry. By the third one, fourth one, we're all
fine.
over.
Before I let you go, just final words for our audience out there. Final words on the role of
Please,
just final
there are
words.
immunizations out there. If I start to list, we will not. They will use Caterpillar to drive me off the program. I will beg you, go to your trusted health facility. Speak to your trusted healthcare provider. Make sure you and your entire family are properly immunized. We don't want to hear, had I known.
No. It's already too late.
Okay. Final words from me.
Thank you so much, Dr. Alero. That was so brilliant for me. You just need it. Please go get immunized. Get it. It's important, especially for children below the age of 5.
Well, thank you so much, Dr. Alero, for coming on our program again. It's actually a very thing of interest, happiness. We're always very happy each time we have you here because you just take us down and you break it down. You actually go to the roots. So we all understand what you say, and I'm sure our audience out there actually follow through all that you have said. And I can assure you that those that have been vaccinated but not immunized will do the right thing. So our viewers out there, I'm sure you had a good time listening to Dr. Alero, our consultant public health physician today. Remember to always follow us on our social media handle, Facebook, YouTube, and Instagram. And if you want to be part of this program, do not forget, just go to our website. And there's a form there, just fill that form. You'll be part of this program. My name still remains Dr. Martina Agbewe. Till next time, stay blessed.
Thank you very much, Dr. Alero. It's always a pleasure. This is a topic that I really, truly enjoyed. And for all our viewers, you can all hear it. Now we talk about this BCG thing. Without the mark, there's a likelihood you were vaccinated, but you are not immunized. So please, even though you are in your 50s or 60s, go get that test done to really be sure, because you can still have tuberculosis. It's always a pleasure having you here. My name remains Dr. Memuna Yusuf Kadri. Until next time, remain blessed.